Borno State Contributory Healthcare Management Agency is stepping to its mandate of revitalizing the health sector in the state by providing leeway for accessing strong and effective healthcare system. This is basically why data offices under the auspices of Basic Healthcare Provision Fund were drawn from the 312 wards of Borno State and went through rigorous training on digital data capturing to pave way for easy documentation and robust healthcare service delivery. The capacity building training focused on broadening the horizon of personnel to ensure that all residents of Borno State have access to effective, qualitative and healthcare services.
Today, we can rightly and boastfully say, we have a school for the deaf. Renovation of a shop for the blind. And here we are. Every month, we are getting some stipend. We don't have the money. Most of us rely on traditional medicine. But today, we have to go and get the medical help free of charge. We thank you, the governor.
Gaskiya ande moskina bula yerwaide ande bula yerwaide awamana irma ande cindien baw dan awwa dana api magade gomna gulen baw ande taida lay kadan bana dana kullay do isa ande bana dana awron galte mana jerian tadi ku isa Borno so do andero.
We will continue to pray to the governor and the president of Nigeria for this whole cause.
Bangiji Allah ya samu din duk sati biyu uku muna taruwa office muna mishi addu'a saboda yana taimakon mu. Allah ya saka masa da alheri.
The enrollment exercise commenced in earnest as vulnerable members of the society from all strata of elderly, people living with disability, pregnant mothers, children below 5 years and the poorest were captured.
Dukkan nakasassu na Borno sai masu karamin karfi ne, kuma muna da yali, kuma muna da yara. An wani rashin lafiya ya same mu, wallahi muna shan wahala sosai. Kuma Allah ya sani, Allah ya taimake mu. Professor Babagana Umaru Zulum tun kafin ya hau ya dauka alkawari cewa in ya hau zai sauka nakasassu na Borno State. Kuma gaskiya ya yi mana sauka mana abu ba daya ba abu ba biyu ba. Alhamdulillah wannan abun ES ya kira ni ya ga mu wannan abun wallahi tallahi dadin da naji a ranan wallahi bacci ma ban yi ba. Mun gode a gwamna Allah ya saka mishi da alheri, Allah ya kara mishi nisan kwana, Allah ya kara mishi daraja, Allah ya kare shi.
Executive Secretary BOSCHMA Dr. Saleh Abba Kaza said government is fashioning out modalities of improving the healthcare system within the state to harness an all-inclusive public and private sector partnership in the provision of high-standard healthcare delivery.
It is one of the mandates of the agency that we have to enroll vulnerable people so that they get actually free healthcare services under the Basic Healthcare Provision Fund program. And it is actually a program of the state in partnership with federal government. The federal government actually contributes 75% of the funding, while the state contributes the 25% of the funding. And as such, we are to actually enroll available vulnerable group into that scheme.
Dr. Kaza has assured to extend the services of the agency to other sectors of the society towards addressing the underlying factors impeding effective health services in the state.
We are actually enrolling them and then we register them into their primary healthcare facilities, such that if they are ill or they are sick or whatever, they can rush to the primary healthcare facilities, and then the primary healthcare facility will give them free healthcare services. And if the condition is beyond the capability of the primary healthcare facility, they get referred into the secondary healthcare facility, and then we also pay for their bills.
Dr. Kaza further affirmed the need to bring new impetus to the visionary focus of the Zulum's administration of repositioning the health sector.
For the start, we are targeting about 35,000 population for the start. We know it may not be enough, but it is good for actually for the start. Meanwhile, the federal government and then the state government will come and actually augment. Okay. The vulnerable group scheme is actually one out of many of the schemes that we are having. We also have the formal sector scheme. That one is for the civil servants in the state, and then as well as the local government. We are also thinking of incorporating these retirees too.